Let me give some brief introductions. My name is Terry Palmer, Dr. Terence Palmer. I'm a psychologist. I'm not a medical doctor and I'm not a psychiatrist. I'm a psychologist. I'm a hypnotherapist and I'm a spirit release practitioner. And I'd like to introduce you to my friend and colleague, Andrew, here. And he is a medium. Andrew is able to access the spirit world where I can't. Now, if you can imagine for a moment a wedge shape with a sharp, thin end and an opposite thick end, okay? I am at the sharp end, the thin end of the wedge. I can't see or hear spirit at all. I'm not mediumistic. I'm no clairvoyant. And most medical practitioners and psychiatrists are at that sharp end. And because they can't see or hear spirit, they assume that anyone who can has some kind of mental illness. Some do have mental illness, but they also include clairvoyants and psychics as being mentally ill or abnormal in some way. Now, Andrew is at the opposite end of the spectrum. He can see and hear spirit very, very easily. Now, there's a positive and a negative dimension to all this. Those people who are able to enter into an altered state of consciousness and communicate with spirit, who have a strong sense of self, who are fully integrated as a human being, these are your people who develop mediumistic abilities and are able to communicate with spirit in a positive, sensible way. People who have fragmented personalities, people with borderline personality, dissociative disorder, people who suffer from psychosis, are on the negative spectrum. And these are the people that can be affected by the negative spirit entities. And these are the people that we're here to help. Now, I'm going to invite Andrew to stand up in a moment and allow himself to be taken over, if you like, in a form of trance possession by his spirit guide, Chen. And I'd like Chen to speak to all of you. Would you like to?
Yeah, of course. Good morning to you. My name is Chen. I'm Andrew's principal guide and surgeon. So I would like to welcome you all here today for this very important meeting and workshop. And I would like to take the opportunity as well to thank our good friend Mr. Palmer for putting this on. This is extremely important work, and this is an extremely important area that all of you have engaged in